And I am pleased to say that in December in Khartoum, Sudan, the document was approved by the MENA Regional Council as a document for MENA region. We only had to then finalize and customize it and present it in Alexandria in May 2017. So only a fortnight ago, I was in Alexandria in Egypt, and we presented this document. So these MENA guidelines, the prompt guidelines, are in fact now MENA guidelines. 22 countries are going to implement it in their countries. 22 countries will accept this document as the national document for these countries. And now there are 12 chapters as per the recommendations of the MENA Guideline Committee. So final part of my talk is future directions. Perhaps you will feel that some work has been done, but what I want to make you feel is a lot of work is needed to be done. And this is important in our parts of the world. We need a lot to be done. So we set our own future directions. We had this Congress in August in Pakistan. A very rich international faculty graced the occasion, and a very rich national faculty helped us out in having this international event done. So the first project we started now is footwear for every diabetic. We say, okay, reduce the amputation rate, but still we need to reduce the ulcer rate. If we prevent people from primarily developing the foot ulcer, we reduce the amputation rate. And this is much more cost-effective, time-effective, resource-effective than to reduce the amputation rate. So we have started this project 2016 to 2019 with the funding from World Diabetes Foundation. It's called FED, Footwear for Every Diabetic. Every diabetic should have a customized footwear. Now, when we talk of customized footwear, the cost comes into play. So instead of franchising it to private organizations, we said that we will limit this footwear production to the teaching hospitals. So the 10 teaching hospitals in Pakistan, their foot clinics generates this footwear. For this, we have to develop the footwear manufacturing facility in these 10 centers, which World Diabetes Foundation helped us out to train the cobbler basically to make a diabetic footwear for our diabetic patients. And this is the first training going on. Belt Nielsen, you can see the white person. He is from Denmark, came to Pakistan twice. He's also coming again in December. So training after training for these foot care assistants. This is the machine, which is Italian-based insole development machine. This accepts the digital pedograph. So the digital photograph goes in for the foot pressures and an insole comes out. We have got this pad installed in 10 different centers in Pakistan. So Multan and Lahore and Peshawar and Islamabad and Quetta, all 10 big cities, teaching hospitals, our advisory board has got these 10 pads. A patient walks on it, gives his foot impression. This is digitally transferred to Karachi, and from Karachi, the insoles are produced and sent back to these 10 centers. So then have their customized shoe made. And this shoe is costing us nearly $10 to $15 for the customized shoes. The next is diabetes and Ramadan. And I can see that Sanjay and Professor Tinsulet has worked on fasting in Myanmar. We are doing the work in diabetes and Ramadan. Professor Yaqub leads the Ramzan stream. We plan to train doctors. So we do workshops and CMEs before Ramadan. And these are the big numbers which we are going to achieve, inshallah. 3,000 doctors to be trained to workshops and courses, and later around 10,000 doctors. We do hold Diabetes Ramzan conference every year. We do workshops in smaller towns, teaching doctors and diabetes educators how to manage fasting and diabetic patients during Ramadan.
CFAM, caring for well-being.